The chair recognizes Ms. Mace.
Thank you, Mr. Chairman. This afternoon, I wanted to offer an amendment that would provide $10 billion.
The clerk will designate the amendment.
Amendment to the amendment in the nature of a substitute to the committee print, offered by Ms. Mace, number 007.
Without objection, the amendment will be considered as read. I recognize Ms. Mace to speak on her amendment for 5 minutes.
Thank you, Mr. Chairman. I consider this freshman hazing my first amendment here in this committee. Today, I rise to offer an amendment that would provide $10 billion in funding for upgrading our country's cold storage facilities and cold storage transportation networks, as well as expanding access to vaccine appointments for those who are most at risk, for those who don't have access to broadband internet. I received a call last night from a constituent who didn't have access to the internet, and they were in tears last night because the appointment they'd made by phone, or that they had made, had been canceled because the hospital had not received their large shipment of vaccination dosages. And this person is an 80-year-old constituent, and they were in tears. And it broke my heart. It put me in tears to see this. And seeing the enormous challenges that are facing our country right now, the challenges of COVID-19, and how can we best and most appropriately help those who have the greatest needs, like getting their vaccinations, helping hospitals in rural areas do this. For example, if you look at the Pfizer vaccine right now, the cold storage the distribution protocols require a negative 94 degrees Fahrenheit to store their vaccination before it can be utilized and put in arms. It's being shipped in very specialized temperature controlled storage shipping containers that are provided also by Pfizer. Urban hospitals across the country have rushed to buy ultra cold freezers to keep supply, to be able to do this, to keep the Pfizer vaccination. These units can cost upwards of $15,000 each. This is a burden that many rural hospitals, like the ones found in South Carolina, like the ones found in so many states across the country, cannot manage and are being left behind. Rural populations are precisely those that are most vulnerable to COVID-19. They affect those who are most in need of help and most in need of the vaccination. So my amendment today directs the Secretary of Transportation, the Administrator of the General Services Administration, in consultation with the Secretary of Health and Human Services, to prioritize creating rural vaccination storage facilities where there is an enormous need. And in those vaccination sites that do exist, that they upgrade to cold storage facilities that can handle, for instance, the Pfizer vaccination. This amendment also directs the government to submit a plan for a streamlined, standardized process which provides appointment scheduling for those with limited access to the internet, limited or no broadband access at all. Another major access issue with our elderly, with our rural population, with our minority, Black and Brown communities who are in rural areas. This is a tremendous need. And I was really disappointed to see that every single Republican amendment didn't even get a shot today. I was really hopeful that we could work together. But Mr. Chairman, I'm willing to withdraw my amendment this afternoon if I can receive a pledge to highlight the issues that we're facing in these areas with cold storage and rural areas and lack of broadband, and work together on this issue in the future. I yield my time.
Ms. Mace, thank you, first of all, for raising this important issue and your contributions on this committee. And on behalf of the chair, I certainly accept your offer to withdraw the amendment with a commitment that we will work with you on the issues raised in this amendment, including broadband and other important issues. There's a lot of work ahead in this Congress, and I think together across the aisle, we can do good things. So with that,